I'm Dr. Tara Gregory. I am one of the physicians at the Colorado Blood Cancer Institute. My focus with patient care is in multiple myeloma, which is a bone marrow cancer, but also in stem cell transplant and then what we call immunotherapies, where we're modifying immune systems to help fight off cancer. I was born and raised in Arizona, went to the University of Colorado. The program at the university actually knew the physicians here at CBCI quite well and recommended that I come over to CBCI to do my transplant rotations. So I did that, and when I graduated they said, hey, we always wanted a transplant fellow. We think it would be for a year. Would you want to do that? And I thought, sure, that sounds great. I don't have to move my family and I like it here. And then about halfway through that said, do you want a job? And so yeah, the rest is history. The average patient that I see, and I tend to focus in multiple myeloma, is a myeloma patient. And our patients, by virtue of their disease, their average age at diagnosis is about 67, 68. So that's my typical population. These patients typically come to diagnosis one of two ways. They went to the 9 News Health Fair and somebody picked up on something that wasn't quite right and sent them in. So they get diagnosed with what we call asymptomatic disease, where there were some little hints on their blood work. The other way that I meet patients is because unfortunately something very traumatic happened to them. They've been having a lot of bone pain for a while and then presented in an emergency department with a fracture. In terms of personal life, I've been affected by blood cancer as well. When I was in training and already steering towards doing bone marrow transplant, I was actually pregnant with my daughter. My mom was diagnosed with myelodysplastic syndrome, and then very rapidly, she was young, she was 57 years old, and before we have a lot of the therapies that we have available now, she passed away within 3 months from an infection. So in addition to doing the doctor piece or the medicine piece, I feel like I do have that understanding and that background of what the family is going through, what the patient is going through. I have a funny story about treatment options that I tell my patients. And I tell them you have a lot of options, and I have to giggle because when my son was 5, and kids always break out with this stuff when you're driving, I think I was driving them to a karate class or something like that, and he said, well, Mom, I don't know who I'm gonna marry, but I do have a lot of options. And he kicked into this story about all the little girls in the class that he liked and what animal he would have to buy them to keep them happy in the marriage. And when it came down to it, he really liked Lucy, but Lucy wanted a horse. And horses were a lot of work, but he really liked Lucy. So I tend to tell patients that story to just, kind of loosen it up. But really, treatment options, when we meet a patient with multiple myeloma, we're trying to decide, are you a stem cell transplant candidate or are you not? And then from there, we are really looking at a lot of different pieces of the patient's disease and how risky it is. With multiple myeloma, we don't stage the disease by, well, it started here and it went there. We stage it by some different factors that determine how badly or well it's going to behave with treatment and time. And so then we'll make some recommendations based on those treatments. My passion, I think, in the workplace and working with patients is really education. I think a lot of times patients say, well, you're the doctor, you tell me what to do, and that's not so much the case anymore. I think with treatment, especially in cancer, we can always continue to do things to people. We can do things until the last minute of people's lives, generally speaking. But I think more importantly, we need to know what the patient's goals are, their quality of life goals, and then sitting down and talking about, does the treatment that I want to offer you honor those goals? And so it's that relationship that I'm passionate about, and figuring out what it is that matters to people and helping them achieve those goals. First off, we have a breadth of education and specialty and experience in this practice. 10 separate physicians currently who have been practicing, some of them since the 80s and 70s, and have really seen transplant come a long way and new therapies. I think the next piece is that we have a robust and amazing nursing staff. I have to say, I think that the patients time and time again are telling me how skilled and caring and smart our nursing staff is. Our advanced practice professionals, such as our nurse practitioners and PAs, they're really stellar. When we work in the hospital and with other consulting services, they always continue to tell us just how excellent our nurse practitioners and PAs are. My personal philosophy of care is just that. It's working directly with the patient, making sure that they understand on a level that works for them what their disease is, why we're doing the treatments that we're doing, what the outcomes are that we're looking for, and then really having a greater understanding about expectations of treatment and outcomes.